Welcome to Essential Therapies podcast, and thank you for joining. It has been a while. Life has just been crazy, and things are busy at the studio, which is great, so I'm not complaining. But I thought I would just pop on here on my drives, and I am going to do several catch-ups and just some thoughts, some quick ideas I want to throw through your head. And this happens to me all day long as I'm seeing people and meeting new patients and seeing what people have gone through and understanding that they don't know the fascial system or why their body is feeling the way that it is. And I just have such a strong desire and a passion to teach and explain all of this. So I'm going to do some short blurbs and share some ideas over the next couple of weeks and try to play catch up on the podcast here. So what I've discovered is that there are many problems. And one problem is that we, of course, are not coming into this world with an owner's manual of how to manage and deal with our bodies. And for the most part, we just don't even think about them. I mean, sitting here right now or walking or doing whatever you're doing, listening to this podcast, are you really thinking about what's going on inside your body and what your leg feels like, or your back, or your neck, or your shoulder, or your hand, or whatever, or especially inside? Now, maybe you are if something's not feeling comfortable, right? That's usually when we kind of wake up to what's going on, such as, my stomach's upset, or your foot hurts, or you notice something that's not quite normal and it's not flying under the radar anymore. You're noticing it. And I like to think of that as the body talking to us. And it really does matter what your sensitivity level is to hearing the body's voice. So we learn at a very young age how to turn that voice off. And I talk about this all the time on several other podcasts. And I think it's really key because I think about when I was a child and going to school and you had to sit in the chair, do what you were told when they wanted to do it, and your body started to become uncomfortable. What would you do? You'd start to, I had a hard time concentrating if I needed to go to the bathroom, or if I was thirsty, or if I was just didn't feel like sitting there anymore. And this is what happens to kids all the time, right? And in fact, the kids who really resist that, they're kind of labeled, if you know what I mean, to be, having issues where they can't sit there. Well, I would like to say that that is a problem. And we are taught very young how to ignore very important signals from the body. And I've taken many, many years, decades probably, when I think about it, to get back that sensitivity and actually make it as sensitive as I possibly can. And part of the reason for that is because of being a therapist. I want to be super sensitive through my hands and just through my whole being, because the hands are connected to everything else, and we are sensing our environment with our entire being. So as I've done that to be a better therapist, I'm feeling more inside my body. And so what I'm trying to do is get you to feel more what's going on. Sometimes we can't just do that by turning on a switch, right? So there are things that we can do by lengthening into our body, moving our body, paying attention, even touching our own body in different areas to say, hey, what does this tissue feel like? Have you ever really thought about that? Like, do you have any awareness of, if you were to grab your calf muscle, let's say, what does it feel like? How does the one side feel compared to the other? Have you ever even thought about it? And if you haven't, this is something that you can adapt to your entire body and start to get more awareness, because without awareness of what's going on in our body, there is no choice. This is something that John Barnes has taught in the seminars from way back when. And the saying goes like this: without awareness, there is no choice. So what's happening, I think, to a lot of people, the body is getting tighter. Things are happening. It's responding to the best ability that it has. And it's giving us signals. Those may be different sensations. And we don't really pay attention to those sensations because we don't really think that they mean anything. And we have a bunch of other stuff to do and we can't be bothered with it, right? So as that progression continues, what happens is that mild sensation gets intensified to a point of discomfort. Then we might do a few little things here or there to try to mess with it. It's not, maybe it's a little effective, maybe it isn't, but it's not as bad, or it's gone for a while and then it comes back. And we're not doing the thing that's going to actually change it completely, but we're delaying it. So now the body makes more adaptations, and that discomfort gets a little more intense until it becomes pain. The pain then, what do we do with that? We'll often reach for the Tylenol or the other over-the-counter medication to try and ease it. Or maybe we put something on it. Whatever it may be, we are treating the symptom when we do anything just for pain without thinking beyond, why is that pain there? Another saying we have in John Barnes' Myofascial Release Approach is find the symptom, look elsewhere for the cause. And this is so important. When you start to really understand fascia and inside of the body, how our body is really put together, it'll make more sense. So the pain then, we medicate it, we do what we can, we maybe do more movements, we maybe get a massage, or we do something else that might help for a little while, but it's not long lasting. It's not really changing the cause. It's still sort of fluffing up around the symptom. And the problem is still there until things get so significant that maybe we go to the doctor now, we get some testing. Now, let's say it's fascia. Everything is affected by the fascia in the body. Every problem that we have going on, there's a fascial component, because the fascia is what holds all of our cells together. It can't not be involved in the situation. So we get testing. What does that testing usually look like? It's an MRI, an X-ray, a CT scan, maybe an ultrasound. These are all testing devices that miss restricted fascia and tightness in the body, which is causing a problem. So oftentimes we leave the doctor's office with medication and, feeling better that the testing came out okay, but we are still having some issues. And we kind of feel like, well, I must be okay. So just like when you were in kindergarten and you had to ignore your bodily symptoms and just, deal with it, that's what ends up happening. So I think it's a huge problem that we don't know how to feel what's going on in our body. We're not taught, it's not encouraged. It's actually discouraged from a very young age to honor our body and what it's telling us. I believe the body has a lot to say, and we can learn a lot from it. And not only learn a lot, but we can take care of our body much better if we are listening and we pay attention. And this is the hallmark of what we teach at Essential Therapies and the treatment that we give. We are focusing on the fascial system, and we are using your awareness to help with that. We use our hands, of course, and our awareness and the skills that we've developed to feel areas of the body that don't feel right. They're not soft, they're restricted. When's the last time your doctor touched your body and really took some time to feel what was going on? They're not taught how to do that, right? This is a myofascial specialty. And so we as therapists who are taught to feel and sense, we can teach you how to also connect to your body, assess what's going on there, listen to what's happening at a deeper level, and move into a position or into some technique or something that's going to help you. And that is the calm technique, which I will talk more about later. Thanks so much for listening to the Essential Therapies podcast. Please share with someone who might also benefit. Subscribe to our channel for more. And remember, you are creating tomorrow's body today. Have a great day.